Well, essential tremor is the most common movement disorder. It affects up to 10 million people in the U.S. There can be relief from the shaking, though, with a procedure called deep brain stimulation, or DBS. In today's Focus on Your Health, Teresa Snow shows us how that works.
Focus on Your Health is sponsored by MU Healthcare.
Deep brain stimulation is used to treat movement disorders like Parkinson's disease, dystonia, and essential tremor. It's an option for people who aren't able to use medication to get their symptoms under control. These days, lunchtime is a little less messy for Michael Laddish.
Before, it was all over the place.
He has what's called an essential tremor. You'll probably still notice a little shaking. But just months ago, cutting meatloaf was practically impossible.
I'm not one to worry about people looking at me, but I was still self-conscious of shaking, especially when I would have the knife and fork trying to cut and I'd do a dance around on my plate.
That's when Michael met the neurologists at University of Missouri Healthcare. During a procedure called deep brain stimulation, or DBS, thin wires were placed in his brain. They deliver electrical signals powered by a pulse generator implanted in the chest.
We sort of interrupt a circuit that has gone wrong, and that improves the symptoms in essential tremor.
Dr. Junaid Siddiqui uses a remote to control the voltage Michael receives, testing different levels.
Does this seem better than the others?
By having Michael draw spirals, he can immediately see when the shake improves.
The instantaneous improvement in symptoms in front of your eyes, I think that's like magical.
DBS is not a cure, but Michael says it made everything, even computer games, simpler.
I'm still shaking, but it's immensely easier than what I was doing before.
Helping him solve the puzzle with a steadier hand. Joining me now is Dr. Junaid Siddiqui, a neurologist at MU Healthcare. Michael's doing really well. He had essential tremor, but this is also used for people with Parkinson's disease. Does it actually slow the progression of Parkinson's?
So there are a lot of indications that it actually helps people stay ambulant for long, able to take care of themselves for longer, and then balance for longer. So there are indications that people who have DBS earlier, they have a longer life because they're able to take care of themselves and stay out of the nursing homes as compared to people who don't.
And have a better quality of life.
Absolutely.
Well, tell me about the team here at the Academic Health Center that helps bring someone to this treatment. There's a lot of team members. Explain that.
Oh, absolutely. So we start with movement disorder, especially like myself. We first evaluate, confirm the diagnosis, and document how far they are in their disease, and then refer to neurosurgery, psychiatry, neuropsychology, physical therapy, and then we all consider the person for this intervention therapy.
We know this is being used for movement disorders. Tell me about some of the other conditions that DBS might be helpful for.
Right. So it is currently FDA approved for Parkinson's disease, essential tremor, and dystonia in movement disorder world. It is being looked at for Tourette syndrome and depression and other conditions as well.
Very important. Thank you very much, Dr. Junaid Siddiqui.
My pleasure.
And with Focus on Your Health, I'm Teresa Snow.
Focus on Your Health has been sponsored by MU Healthcare.